This is Living Healthy with the Woman in You, the show with the information on health that you need to know from people you can trust.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. There's such an abundance of information available about women's health, and especially hormone health, that it can be confusing to put it all together in a practical way and to use the information as it best applies to us individually. With us today is Dr. Dawna Jones, CEO and Medical Director of Bella Natural Health and Gynecology in Hanover, Massachusetts. Dr. Jones is a board-certified obstetrician and gynecologist specializing in natural therapies for menopause, hormone balancing, and women's health concerns. And we'll be discussing the role of hormones in women of all ages and natural ways of keeping them in balance. Welcome, Dr. Jones.
Thank you, Jackie.
So let's talk first about PMS, since that applies to every woman on the planet at some point or another in their lives. PMS, let's just describe what it is, and then we'll go from there.
Okay. And PMS, also known as premenstrual syndrome, is really just an imbalance of the hormones. We see it from the start of puberty all the way up until the time of menopause. And basically, many times we see it in a certain part of the cycle. And so you have to talk a little bit about the menstrual cycle and how that works in order for people to get a full picture.
Yeah, because when we think of PMS, I mean, it's part of the menstrual cycle that every woman goes through, but some go through it a little less comfortably than others.
Exactly. Well, what happens during the menstrual cycle is generally you grow an egg on your ovary first and you're producing estrogen in the first part of the cycle, so the first 14 days. The second 14 days are following ovulation or the release of an egg when you're producing progesterone. And that is to allow for fertility, for you to be able to get pregnant. If pregnancy doesn't happen, the hormone levels drop off and you have a menstrual cycle and you start all over again. So what's happening in women when they're experiencing PMS, generally there's a lot more estrogen than there is progesterone. And the more common times that we see that is at puberty, when teenagers are starting their cycles, and perimenopause, somewhere between 40 and 52, when the eggs are a little bit older and they're more resistant to ovulating. So again, you have a lot of estrogen and not as much progesterone, and that produces symptoms.
So why do teenagers get it, and what are some of the symptoms that they might encounter?
Generally, when teenagers start, and in this country, the average age is about 12 and a half years, they'll start their menstrual flow. And the brain is sending signals to the ovary to kind of get the ovaries in the routine of having a regular cycle. So that routine may take as long as 6 years to be established. So between 12 and 18, you can have many cycles in which you're not ovulating. And in the first 2 years of that, about 90% of the cycles are anovulatory. And so you're not releasing an egg. In that case, you have a lot more estrogen than progesterone. And so they have that component of it. We also find in young people there are nutritional factors that make a big difference. You know, teenage diet, teenage world, maybe not getting all the fiber and vitamins and fruit and fresh foods.
Right.
All of us fall into that,
foods.
Right.
So what are some of the symptoms that the teenager might suffer? What are usual symptoms? Would acne be one necessarily?
Acne is one we see a lot, and that may have to do more with not ovulating regularly. We may find that there's a little bit higher level of testosterone floating around in the system. So the male hormones that we also produce from our ovaries may be a little bit more abundant in a cycle in which they have not released an egg. And you have more sebum production, meaning you have more oily skin, you have more oil produced, you have a adult body odor. And those things are happening in addition to the other issues that we've talked about with estrogen being high that may make them feel bloated, crampy, water retention, kind of crazy in a way. The progesterone has a tranquilizing effect on the brain, and so that also may help them to feel calmer if they're ovulating regularly.
Oh, so like you were talking about feeling a little crazy or anxious or angry or irritable is really a good PMS.
Right, and there's ways to approach that naturally. Many times the teens who come into my office are not interested in being on the pill. So they're asking me what they can do.
Yeah, what could a teenager do
to make them feel better?
Especially one who's having heavy cramping and really uncomfortable.
That's one thing that I didn't mention. When you have higher levels of estrogen, generally you have more stimulation of the breast and you have more stimulation of the tissue in the uterus. So the lining in the uterus is much, much thicker. When they finally do have their period, there's a lot more tissue to come out. So the bleeding can be heavier. They're making other hormones in the body like prostaglandins. There's a much higher level of prostaglandin, which causes headaches, cramping, diarrhea, moodiness.
And that usually lasts maybe 2 or 3 days?
It does. Sometimes the PMS can last as long as 2 weeks. And so this is when all of these factors come together. It's like the perfect storm.
Some women are more estrogen dominant than others. So would they be the ones who might tend to feel more of these symptoms or feel them more strongly than other women?
That's a possibility. We may also find people who are deficient in some vitamins and minerals that their body is looking for. For example, somebody who's under extreme stress may be using up all of their B vitamins, C vitamins, E vitamins.
Or if someone had been sick with, say, mono or something, where that would be a stress on the body too.
They would have some difficulty with the liver in that case, and the liver is where we metabolize estrogen. So they may have some problems in moving estrogen out of the body effectively.
So what would you say are maybe 3 or 4 foundational things that the average woman could do depending on her symptoms, so someone who barely has any symptoms but is maybe moody compared to someone who has really a lot of cramping and irritability and anxiety. What are some of the foundational things that people could add to their lifestyle?
I think one of the most important things that I talk to people about is nutrition, because the first and foremost is that we have to feed the body. The body is utilizing certain minerals and vitamins in order to balance our hormones. They act as cofactors for you to produce, for example, hormones that help you to cope with stress, or hormones that help you do other activities, including clearing estrogen from the body. And so we start with a good foundational diet, get rid of the snacky foods as much as you can. And generally the highly processed foods are depleted in those vitamins and minerals that you need. One of the things I talk to teens about who have a lot of cramping is that prostaglandin theory that we talked about. I don't know if a lot of people remember, but back in the 80s, they started using things like aspirin and Advil and Motrin, and all of those, the basis of it is that they're prostaglandin inhibitors. But there are ways that our body can inhibit prostaglandins naturally, and one of those is certain essential fatty acids that we get into our diet. And so the fatty acids also have a balance. Omega-3 fatty acids will help us to produce less of those prostaglandins that cause a problem.
So typically what are some supplements, in addition to eating more fiber and cutting out the wrong kind of snack foods and wrong beverages?
Right. One of the supplements that we have people go on is flaxseed and chia seed. Both of them have a component that bind to the estrogen receptors, so they kind of balance out the estrogens. In the teens, we use evening primrose oil, which doesn't have omega-3 fatty acids in it. It has a different kind of essential fatty acid, but it also will help with prostaglandin balance. So we start there We have them take an extra B vitamin. We have people use magnesium. The magnesium is a smooth muscle relaxer that is a natural way to relax and tonify the uterus. And so those together seem to work really well. And I find that some people don't have a need to use the prostaglandin inhibitor, so they're not having to use Motrin or Advil. They're starting to feel a little bit better. Some of the other things that we've done in women who are a little bit older, if necessary, is that we know that the progesterone is probably not going to come back. So some women have used progesterone cream on their
skin.
skin.
Do you test for that usually? Because I know a lot of women would think that, you know, they could just look on the internet and then decide for themselves. Would you advise testing because it might not be necessary for them?
Sure. We can test with saliva. You can also test at a certain time of the month with blood. Not all of the insurance companies will pay for saliva testing. If you want to have a full panel for a woman, she may have to test throughout a month so we can see a pattern of what's going on with estrogen and progesterone. But many times when I sit with women, I hear what's going on, and so sometimes we have prescribed without doing the saliva testing. We've done blood testing if we were suspicious, and we give them that anecdotally and see how they feel when they come back.
So would that be in addition to the basic things of the essential oils and if they need magnesium and vitamin Bs?
Right. So you start with, we talked about the vitamin supplements. We also talked about diet and getting back to a more natural way of eating. In the teens, I haven't found that I've needed to use a birth control pill if they wanted to do something more natural. We've used supplements, herbal supplements like chaseberry, also known as Vitex, and that seems to work very nicely in balancing the hormones. It actually works in the brain at the level of the pituitary to rebalance the cycles. In women who are closer to menopause, who also don't want to use a progesterone cream, we can use that. We've used wild yam in a tea or taking the whole herb, and your body does figure out what to do with that wild yam. If you need estrogen from it, it'll use it for that. If you need mostly progesterone, it'll use it for that. You also get DHEA and testosterone from wild yam, so it's multitasking.
And then the next step further would be the hormone replacement therapy for women. Is that necessary? A lot of women feel that once they stop menstruating and they're into menopause, that they should go on hormone replacement therapy, like it's an automatic thing they should do, or if they've had surgery. So what would be the most practical, the wisest ways of using hormone replacement therapy? Because I think that it's overprescribed in general.
We found in our practice, when people come into the practice, I need to sit and talk to them to find out what their basic needs are. Everybody doesn't need hormone replacement, and sometimes it really has to do with lifestyle changes. It may have to do with their level of stress. It may be how they're metabolizing other hormones other than estrogen and progesterone. Sometimes we find that a lot of the women who come in can be managed in other ways. We have natural therapies for menopause as well as the bioidentical hormones that are used, but not everybody needs estrogen. That's a misconception.
And do you find too that a lot of it depends on a woman's health history, whether she's been on contraception for, and how long and how that affects her, one woman versus the other, how many pregnancies and births and how many infections and chronic problems she's had, as far as whether her body can retaliate and get back in balance easily.
Well, I agree with that. That's why it's so important to sit with the patient and actually listen to the history, because it gives us an opportunity to individualize their therapy.
I just have one more question about along this line, and that has to do with homeopathy. Where does homeopathy come in balancing the hormones. Is it possible to actually, for someone to, even if they have a lot of symptoms, maybe they need something more drastic, to move towards homeopathy as a way to balance their hormones, or even to use it from the very beginning?
Exactly. Well, the homeopathy is very different from using herbal therapies. With homeopathy, you don't have any of the whole herb in that therapy. And so it again is based on individual needs. There are certain homeopathic remedies that are very potent and very effective at taking care of menopausal symptoms. Even something as simple, it's interesting, but homeopathic ovary is a remedy that could be used. So say, for example, if you wanted to tonify the whole reproductive system, and you started with homeopathic pituitary, which gives signals to the ovary and the other endocrine organs that are involved, like the thyroid and the adrenals. So if you have a tonic that has the homeopathic pituitary, homeopathic ovary, homeopathic adrenal, and homeopathic thyroid, you can tonify the entire system without using any hormones at all.
Wow, and does that seem practical and applicable for someone who's had a hysterectomy?
It does work well. I think it's important to explain to the patient what you're trying to achieve with it, and that both of you have realistic expectations. Some people are very motivated to not be on hormones, and there are some patients that should never be on hormones. But we have been able to use hormones effectively. We use them as bioidentical hormones. They're safe to use. I found that the majority of the patients don't want to be on it long term, though. Many of the patients stop themselves before 5 years, which is actually under the guidelines of the American College of OBGYN. So.
I'd like to remind our viewers that you are watching Living Healthy, and today we're talking to Dr. Dawna Jones from Bella Natural Health and Gynecology about hormones and the role they play in women of all ages. So we've talked about PMS, we've talked about women's hormones and what you can do to balance them, and very basically we've looked at that. There's something though that I think is of concern to all of us, and that's how much environmental toxins affect our hormones. So much more now than anything we've ever encountered before in history. Could you help us understand a little bit more about what we're facing?
It's very interesting, Jackie, because they have done some studies in Denmark and Norway. First, talking about the early onset of menarche in young women. It dropped from the age of 18 to about an average of age 12 now. They think that some of that
That means that if it's an average, that girls who are younger than that, 10, and are getting their
could be starting their
menstrual
periods
cycles.
earlier. And in African American women, it's even earlier, so the average may be more around 10.
Wow.
Some of that, they think, has to do with hormones that we're getting in our environment, including hormones that have been used in the meat industry with our food. Also pesticides, certain pesticides that are outlawed in Europe, but became outlawed later in the United States, like PCBs. The majority of the population here in the United States, if you were born here, have PCBs in their breast tissue. And what has become more prevalent in our society is BPAs. We've talked about the chemical that has been used in plastic bottles.
And that is an estrogen mimicking plastic, so the chemical is very similar to estrogen?
And so the body sees it as estrogen, and it also will concentrate in the prostate. And so they're starting to look at that as a possible.
So what do we have to do? We have to be careful of the plastics that we're using and how we use them, make sure they don't heat up. And
yeah, one of the things that came up, I think it was 2 or 3 years ago, the BPAs that were in the baby bottles, and that was really what brought this to light, that people were using formula or breast milk in a plastic bottle and heating it up in the microwave. And one of the things that we really need to be aware of is that the heated up plastic allows the BPAs to leach into whatever it is. So if it's microwave food, if it's water that's been sitting in the car, if it's water that was on a car mat that they brought into the warehouse and now put in the refrigerated section, it's still already been exposed to heat. And all of us are involved in that. We have to...
And so how do you see, what are typical symptoms that you might see that give you a suspicion that someone might be a little bit toxic, and then what can you do about it as a physician?
I think what we see in younger kids may be some evidence of precocious puberty. In a young girl, it may be the onset of the breast bud earlier than expected, maybe someone who's 5 or 6 years old. And sometimes, 7 or 8 years old, but we're seeing it in 4 and 5-year-olds. So that's been a concern. I think the incidence that we've seen, a higher incidence of prostate and breast cancer in this country, may be linked to what we're exposed to in the environment. And what I'm seeing in the office is what we're calling a non-alcoholic fatty liver. And so many women come in complaining of not being able to lose weight and feeling sluggish, retaining water. No matter what they do, they can't lose weight. Part of that has to do with metabolism. Part of it is the hormones. We talked a little bit about estrogen dominance. Some of it has to do with stress. Some of it has to do with how their body is utilizing the food that they're eating. But all of it is linked to the liver, because the liver is the main detoxifier for the body. We have one liver, everything has to go through it, any medications, everything has to be detoxified by the liver, including the hormones that are in our body and the hormones that we're taking in from the environment. So the liver really gets overwhelmed with this, and then it doesn't do as good a job at picking up the trash. And so you see things like high cholesterol, high homocysteine levels, high bad cholesterol in the system. There's irritable colon that we see, people with gallbladder disease. All of that are signs that we see, including the expanding waistline.
And so what do men face? I know that that's not your specialty, but if it's going to involve the hormones and it's going to involve every person on the planet, what do you know about how men are being affected by this as well?
I think what we're seeing with men, and of course I don't usually see men, but there seems to be a much higher incidence. I think everybody's noted this, of prostate cancer in younger aged men. It used to be something that we see or saw in men who were in their 80s and 90s, and now we're seeing it in men who are in their 40s. So that's one of the issues. The men come in, I've seen 4 or 5 husbands of our patients, and they have the same kind of symptoms. They're sluggish, they're under stress, they have a big gut, they can't lose weight. I think it's the same issues.
Insomnia and anxiety, those are all, problems that affect other parts of our lives. That when women can't sleep, or they have the hot flashes, or they feel anxious or fearful, or depression is huge nowadays. Do you think that these toxins are playing a role in that as well? Or do you think it's more of a combination of everything, diet and lifestyle and
the toxins can be playing a role in that. Our systems, when we look at systems like the cardiovascular system or the neurological system, the neurological, endocrine, and immune systems are all connected. And so it's not possible to really separate those. So if you have a toxin, say for example, that's coming in through the gut, just say basically you ate something that the body doesn't think is food.
Right.
Okay, it's an apple that has pesticides. It was, Cheese Whiz, whatever you ate. The body has to take care of that. And when it gets down in the intestines, if it doesn't look like food, this is where 70% of your immune system is. And so your immune system is going to be kicked up. What happens with that is your immune system or the intestines are now fighting foreign invaders, those toxins, instead of absorbing nutrients. And so it kicks off a whole nother issue. You don't have the protective bacteria, you start to have yeast overgrowth. That also impacts on your ability to eliminate these toxins from the body. The liver is not working well. And so all of that's going to impact on the endocrine system because it's all one system.
Mm-hmm. So if someone has migraines, they can't really just blame it on one thing.
Yeah, most of the time when people come in and they're talking about migraines, I really think about that as being inflammation in the body. So I look at different areas in the body. It may be inflammation that has a hormonal trigger. So they have these migraines around their period, but really the whole issue is they're having an inflammatory response. So what kinds of things can we do to fix that? Mm-hmm. And one is making sure they're eliminating well. Most of them have fibromyalgia and irritable colon on top of it. So the first thing is make sure that their nutrition is good and that they're eliminating well. And you use other things in the diet to decrease inflammation. And then for the hormonal trigger, you could use something like Vitex. You can use omega-3 fatty acids to try and stabilize the wall of the blood vessels so it's not in spasm. And you can use magnesium. So sometimes that's enough to decrease the migraines. We've used that along with homeopathy. It really depends on the patient.
So it looks like those foundational things can at least reduce symptoms, and then you can set up an individualized program for each person.
I think so.
Thank you, Dr. Jones, for being on our show again. The half hour went by so quickly, and the information is extremely valuable for all of us.
Yes, thank you, Jackie.
For more information on Dr. Jones, visit bellanaturalhealth.com. You can also contact her at 781-829-8900. Thank you for joining us today. I'm your host, Jackie Bell. We'll see you again next time on Living Healthy.